All right, our next update on Mr. Petey, if you can even see him in this big cozy bed, which he's enjoying. We got blood work back, amazingly good. Really no concerns, very typical for sort of an age of 13, which is what we think he is. You know, I mean, everything is pretty much in the normal range. You know, high end of normal maybe for kidneys, but as the vet said, very, very normal for a 13-year-old. Nothing showing crisis or anything like that. Thyroid is normal. We've been doing fluids every day, which is helping. We do have him on a pain management program, which he's probably going to need to stay on, because his biggest problem, as I said, are his joints, which are just no longer really movable, bendable, usable to maneuver around a whole lot. So he's going to be a very quiet cat that's going to need to just stay in one big cozy situation. So smaller place, I mean, he can go into a large house, but he's going to end up staying in a very limited area by his choice. So a big comfy bed like this, maybe even heated, would be nice. Close food right near him where he doesn't have to move very far to get it. Very close litter box right near him where he doesn't have to move very far to get to that. Low litter box. I actually was thinking of looking for one that was lower than this, even, so that he didn't have to step up and over. And we talked in the first video about other cats. He initially really was agitated with the other cats. Now he doesn't seem to care a whole lot. So I don't know, you know, I think he's going to be more concentrated on trying to feel good than he is worried about other cats. My guess is that he's been outside for a long time and been beat up. We know he's been shot at with BBs, but been beat up by other cats, and that therefore, you know, he's sort of defensive. So I don't think he wants to really be bothered by other cats. He certainly doesn't have the energy to fight them off. So we need to look at the other cats in the house very carefully to make sure that they wouldn't bother him. Other than that, you know, we'll send what we have to get him started as far as his pain meds and stuff. That is gabapentin is what he's on currently. I'm not sure, honestly, on the pricing for that, so something to look into as far as that goes, because he will most likely need that as a continued prescription. Cosequin, which is not pricey, we can send some of that certainly with him as well. So that's his deal. I do think if we can find a home, we'll get this little mast cell tumor removed. I was talking to the vet about that. It's a tiny little white pimple over the right eye. She can do that with just a very light sedation and a quick removal, one stitch. So I think that's worth doing if we can find the right home and we can, you know, feel that we can make him comfortable enough to sort of move into and transition into that home and have some quality of life left. But blood work indicates, you know, he could be around for several years, but he's just going to be a very sedate boy. I do think he's a bit deaf. So he does the dead cat imitation sometimes, where you kind of come up to them and say, hey buddy, and nothing's happening. But you know, other than that, he's great. Really very nice, purring away, very friendly guy. So that's his deal.